Health is a very important part of the development of a country. There is the concept of health for all, which was originally described or put forward in some years ago, and health for all by the year 2000. The new paradigm is health in all. In other words, health plays a part in every single part of the development of a country. Without good health, you cannot have productive citizens. And as we shall see, all of the other sectors also are involved in the management of health. Now, my remit was, what is the expected impact of the budget as it relates to the development of initiatives in the health sector? What part can secondary and post-secondary vocational education and training play in the development of the health sector? What positive outcomes do you foresee as emerging in the health sector from this budget? What gaps have you identified in the budget as it relates to the health sector? What part can education and training play in closing these gaps? And what are your suggested recommendations for education and training for those involved in the health sector? This is what was given to me by UTT. Well, let's look a little bit at some of the things that the budget talks about. The budget talks about the development and building of the National Oncology Center, best practice standards for dialysis patients, construction of 5 hospitals in Pinal, San Grande, Rio Claro, Point Fortin, and the Couva Children's Hospital, 3 health facilities that would be constructed, Chaguanas, Chancery Lane, and the San Grande Enhanced Health Center, the upgrading of 2 health facilities, Arima and Couva, and 3 health centers in Togo, Palo Seco, and Caranage, and a more efficient CDAP program, because they're going to introduce what is known as the health card, so that all the person's demographic data and medical data can be accessed and can be carried portably from one health institution to another, and the development of a national health insurance scheme, and finally health information systems, and a training center at El Dorado for nurses. So what are some of the positive outcomes of the plan, the budget? Well, certainly there will be an improved cancer care. Cancer is its 5th leading cause of death in Trinidad and Tobago. So we certainly need an oncology center, a public oncology center. Improved dialysis treatments. Kidney failure is a significant complication of both hypertension and diabetes. And so we certainly need improved dialysis treatments. Now also, when we build these hospitals, what is going to happen is that we are going to improve what is called our bed space. According to the World Bank, we have 2 beds per 1,000 in the year 2006 to 2011. So when we build these hospitals, we are going to have an improvement to 3.1 beds per 1,000. That might sound great, but look at this. Guyana has 2 beds per 1,000. Dominica, we haven't built it as yet. We are going to get 3 beds per 1,000 when we build the 5 hospitals. Dominica at present in the year 2011 has 3.8 beds per 1,000. Barbados, 6.6 beds per 1,000. So that if we are yes, it is good that we are building these 5 hospitals, but if we are going to come anywhere near international standards, after we have built those 5 hospitals, we have to build the same number again in order to be able to achieve adequate care at a tertiary hospital level for our population. Not only that, health is not just about hospitals. There are a lot of things that impact upon health. We refer to that in the health industry as the secondary or the social determinants of health. As you can see, the individual lifestyle factors impact, the social and community networks impact, and other things, other sectors, the work environment, the living, unemployment, water and sanitation, healthcare services, agriculture and food production. All of those impact on health. So let's look at the budget to see what happens, and look at these social determinants of health. Water, in the year 2010, according to the budget, 18% of the population had water 24 hours a day for 7 days of the week. They say in the year 2013 it will be 49%. In Tobago, in 2010, 23% had water 24 hours a day, 7 days of the week. They say it will be 67% in 2013. We shall see. Transportation also impacts on access to health. Improved roads and bridges and highway systems that are planned will help. And this here is a matter of social justice. People ought to be able to get to health facilities quickly. And that is why we need these things. So improved transportation arrangements not only for ordinary people, but also for the elderly and the differently abled. Housing units, it's planned 75 housing units in 3 years. That also impacts on health. It impacts on the ability to work. It impacts on mental and social health, and land for the landless. Tertiary education, as well as early childhood centers, are also important in making people healthy. And there's a plan for the U campus at Debe and Costard campuses in Chaguanas and Tobago. So all of these things need to be taken care of and considered whenever we are planning for health in Trinidad and Tobago. In Tobago, 20 million equipment for the Scarborough General Hospital and an MRI, 5 million for UTT's Tobago's campus and Tobago's Technology Center, 43.8 million for upgrading water distribution centers. And this is something about the Tobago Regional Health Authority that I'd like to very much commend. When they were planning to what they wanted to do for this budget year, they conducted what is known as a health needs assessment. In other words, they went to their people, the population, and said, tell us, what are your health needs? It wasn't someone sitting down on the third floor of some building, some group, some committee who says, we know what the health population needs, and this is what we are going to, this is what we are going to plan. No, they conducted a health needs assessment from the population, and based upon that, they developed a strategic plan for health in Tobago, and that is something to be commended. So what are some of the gaps? Well, the budget does not address the important area of primary health care. Now, when we talk about primary health care, we must not be confused with primary care. Primary care is the first person you meet when you go to the hospital or to the health center. That's primary care. And then there's secondary care and tertiary care at hospital. We're talking about primary health care is a term that encompasses everything, all of the social determinants of health that we talked about. And it involves participation by the community. So that has not been addressed. We have to try and get people to be responsible for their own health. And we have to try and get the community involved. So that is why some people refer to primary health care as integrated health care, making people more responsible for their health. And then to another gap that is missing is riding the wave. I refer to it as riding the wave. One particular consultant in management says that there are two things that happen in the environment when we look around. There are shock waves and there are trends. Now, if an organization doesn't recognize the shock waves, those shock waves could be like a tsunami. It will overpower you and inundate you. But if you know with your management that you can ride that tsunami, it could carry you much further. What is the tsunami that is going on in the world today? It is information technology. It is social networks. It is smartphones. The health system needs to harness that and ride that shock wave. In other words, why is it a person cannot pick up his smartphone and dial into a system, put in a password, and find out what his reading was, his last sugar reading was? And why is it after he has done that, can he not ask interactively, what should be my dosage of so-and-so? To prevent them from coming to the hospital. And then there's social networks. So this is something that we need to do. We need to recognize that this is a trend that is going on in the world. And as health professionals, we need to ride that shockwave, ride that tsunami, and harness the tremendous potential of technology. The other gap in the problem is procurement for health. Now, procurement is a problem because it has to be transparent and so on. But procuring things for health is a real problem. The methods by which procurement goes on, you have to put in, you ask for 3 quotes, and then they look for the cheapest one, and then you decide on, and by which time, what is happening to the patient. So whenever we ask for something, we have a long time to get it. And then one of the speakers mentioned monitoring and evaluation. We do not know a lot of basic things about our health system, and I'll talk about that a little later on. And health, human resources for health, that too is a gap. For example, we talked about procurement for health, pharmaceuticals. One particular company that supplies pharmaceuticals for the government service is NIPDEC. NIPDEC is out of many drugs for many months. And every time we ask them, a very vague letter comes back that says, not available, in process. Phenytoin is an example of that. We don't have it, and that's very important for epileptics. So we need to develop, what about stockout flags? And this is an age of technology. Why is it that programs can be written where when you reach a certain critical level of a drug, it's flagged on your computer system? And there's a lag, usually there's a lag time. You should know what the lag time is so that you should not have stockouts. For equipment, the procedure is long and cumbersome to get something. When it has to go to tender, and then after it is tendered, you have to award a contract, and then there's a lag time. All in an attempt at transparency, but it is still subject to manipulation. People can still manipulate it. Recruitment is a problem. And the main reason, one of the problems with recruitment is remuneration. People go where they will make money, where they will have a good salary. We are not going to be able to address the best professionals if our remuneration is not anywhere close to international standards. We have retired neurosurgeons in the system. We have retired ophthalmologists in the system. We need to deal with that. So, working conditions. I want to mention this about working conditions. I want to tell you that professionals are high achievers. That is why they're there. And most of our medical professionals are not motivated by money. Most of our medical professionals are motivated by achievement. And if you do not provide the working conditions to give them achievement, they will go somewhere else. Retention is also a problem. And so, ladies and gentlemen, as we build all of these hospitals, there is going to be a need for medical professionals and paramedical professionals. For you, there's going to be need for radiographers, for ultrasonographists, for lab technicians. Notice I didn't say doctors yet, nurses, perioperative surgical technicians. And the problem also that we have is maintenance. Maintenance. We do not maintain our equipment. So there will be need for biomedical technicians where we can maintain. So at the end of the day, I will echo Mr. Karim's mantra: training, 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 and that is where you come in. So there will be programs by UTT and others, which I would like to encourage you. There's a bright future ahead for you. You need to work hard, and you need to take into consideration some of the medical and paramedical professionals that will be available in the future. Thank you very much.